Hi, I'm Joe Chili, mornings from 7 to 9 at Buffalo's oldie station, the Big Weck. Joining us on the Big Weck's Buffalo on the Rise today is Jonathan McDonnell from Buffalo Advanced Medical Acupuncture.
Hey, Joe.
How you doing?
I'm doing well. How about you?
Good, good. Good to see you. You know, one of the first things I want to talk about, is the whole needle thing. Because, people get a little bit nervous about this.
Sure.
But, I just talked to somebody who was in to see you just a couple of days ago.
Yeah.
We're talking
mutual
about
friend of ours, yeah.
Our mutual friend. And he says, oh, they're little dinky things. You don't even feel it like that. And so I said, that's great. And that's what Jonathan said before. So the needle thing, people have this fear that maybe it starts when they're young, right? Because I remember saying to the doctor, I'm not going to get a shot, am I? You know what I mean? But it just continues through your whole life, or what's the deal here?
I mean, I do think that's where it starts, right? Your first experience with a needle is generally not a good one. I mean, there's a couple differences. I mean, number one is obviously the size of the needles. That's the first misconception. People come in and they're like, oh, it's just that little thing. And then they're kind of surprised, like, oh, that doesn't really hurt at all. But then the next thing I get is, well, how does that little needle do all this for me? I think that's really the magical part, right?
Well, that's the thing, and it's not just one. It might be a series, right?
Right.
And do you have like a map? Here's the big map of the body, and here's where you have to put the needles for whatever. Is it something like that?
It's definitely. I mean, not so much a roadmap. It's more like a recipe. Like I have a lot of recipes that I've learned and created over the years, right? So, and what I mean by that is, when you're cooking something, it's the combination of flavors, right, that really make the dish. Same thing when we're talking about selecting acupuncture points where I'm going to put the needles. It's the combination of points and how they work together that is really what makes them powerful.
All right, so here's the thing that I don't get, and maybe you can explain to our viewers. My shoulder hurts. That doesn't necessarily mean you're going to put needles in my shoulder, though, right?
No, not actually. I probably would hesitate to start there. I mean, that there certainly is a method. One way you can go about treating a problem is just, I hurt here, just let's throw a bunch of needles into it, right? And that can be quite effective. But the acupuncture, and I consider that more like dry needling, which is definitely something I do. But the problem with that is if somebody has like a real chronic condition that's been around for a long time, a lot of times if you put a bunch of needles in that can make it feel worse for a little while. Putting needles away from the area, for me, it's almost about like, if you have a real chronic problem, to me, there's a lot of stagnation there, right? Like fluids aren't getting there, blood isn't getting there, that tissue isn't getting the nourishment it requires, and that's really why it becomes painful and dysfunctional. So my first step generally is to draw that stagnation out with the acupuncture needles, which is putting needles away from the area. I like to do that method because, number one, that's kind of the way I was taught what they do in China. And number two, there's really no chance that I'm going to make anybody worse doing that. In fact, that's probably the quickest way to kind of get them that instant relief.
Well, that was going to be my next question. How long does it take? How many sessions when you go in? Is it 5? Is it 10? Do I experience some immediate relief?
That is a very good, popular question. Probably one of the first questions that most people have when they come through the door. Unfortunately, I don't have a real clear-cut answer for that. And the reason for that is people are complicated. I think as a general rule of thumb, if you have a chronic condition that you've been dealing with for 10, 15, I mean, I have some patients that are dealing with their problems for over 20 years before they realize, like, oh, maybe this guy can help me. The more long-standing your condition is, generally the longer it's going to take to get you where you want to be. But, our mutual friend came in, it was just a small injury that he had, and, he's going to come in like 3 or 4 treatments and he'll be good to go. So there really is that kind of variation. If it's more of a simple problem, an acute problem, a couple of treatments, you might be good to go, sometimes even 1 treatment. But generally what we specialize in, BAM, is more of that complex patient. The patient that's kind of been on that roller coaster ride of going to this specialist and that specialist, and they're kind of at their wits' end. They've lost hope. That's really the patient that we're here to help at BAM. So those do tend to be, they might come to see us for a month, 2 months, some patients maybe even 6 months.
So I don't know whether I want to ask you this or not. Are you like a last resort?
Often, yeah. I mean, I've been practicing for 20 years, right? I remember when I first started in practice, I wanted to save the world, and I couldn't understand why didn't you come to see me first? I think it's just like, it's not the most appealing idea of ways to treat a problem, right? Like, I'm gonna go to this guy and he's gonna stick a bunch of needles. I don't know, maybe I'll go to the dentist first, right? But I think it's important for people to know that I do a lot more than just the needles too, right? Like at Buffalo Advanced Medical Acupuncture, one of the things that makes us unique is we blend these more modern, innovative techniques with the acupuncture. I mean, sure, acupuncture is gonna do a lot of the heavy lifting, but it's really the mindset that is Chinese medicine that really is the magic of it. And what I mean by that is if you take Eastern medicine in contrast to Western medicine was really developed with the idea of saving your life. You know, like if you're having a heart attack, that's where you want to go.
Yeah.
But where it falls short is often treating that more chronic, complicated condition. Eastern medicine, in contrast, was really developed to keep the emperor of China alive and as youthful as long as possible. So, you know, it developed with that mindset. So that's why I think it's really much better when you're treating things like neuropathy, things like chronic pain, things that are really going to kind of suck your life force and make you old, quite frankly. I want to keep you young.
All right, Jonathan, appreciate that. For more information and answers to your questions, contact Buffalo Advanced Medical Acupuncture by calling 716-632-2207 or go to bamacupuncture.com. Sponsorship and promotional consideration for the preceding segment was provided by Buffalo Advanced Medical Acupuncture. And don't forget to join me weekday morning, 7 to 9 a.m. on Buffalo's oldie station, The Big Wagon.